Welcome back, and here we are now into part two of this lecture on muscles and muscle tissues. There are a number of different ways that you can look at strength of skeletal muscle contraction, but it really does come down to sort of two things, and we're going to focus on basically one of those two things, and that is what we call recruitment. Okay, so recruitment is the number of continuous motor units or the number of simultaneous motor units that you fire. Now, this slide is saying and frequency, that's true. There is some of that as well. And what we're trying to get at here is that as you increase the number of motor units, your ability to increase strength goes up. All right. Up to a point. Now, you can also get the frequency of stimulation. That is to say, if you fire off a stimulus, here's a stimulus here, you'll get a certain kind of contraction. You let it fully relax and you fire it off again, you get the same strength of contraction. This is one muscle fiber, okay? This is all one muscle fiber. But if you fire and then you fire again, you'll get a stronger contraction than you would have, even though the stimulus is the same size. It's happening sooner, and this has to do with the length of the sarcomere at the time of stimulus. Okay, we call that length tension relationship, but in this case, the thing is, how many motor units are you recruiting, and how often are you stimulating? Now, you can stimulate very, very fast, and you'll quickly get to what is known as tetanus, which is complete maximal contraction and subsequent rapid failure. This is what we call complete tetanus. You don't see any waggle here because you're firing off stimulation so quickly. The tetanus basically goes until the muscle begins to fail. All right. So a single twitch is like this right here, where you have initiation of contraction, and then you have a period of relaxation. If you happen to fire off again sometime during this relaxation period, the subsequent contraction will be stronger. So number of simultaneous motor units fired, all right, and how often you fire them. So putting this all together with a few additional nuances. Recruitment, that's the number of muscle fibers that are firing simultaneously and how frequently you're stimulating them are big players. Then on a little bit of a situational thing, how large the individual muscle fibers are. So if you're working out and you're building up your muscles, you actually are developing more and larger muscle fibers with more sarcomere filaments and so forth. That's why you can get increased strength here. And then lastly, a little bit of stretch here. This plays again into what's called the length tension relationship. But again, a little bit of stretching and large muscle fiber diameters. But the main driver is the number of fibers simultaneously recruited, along with how frequently you're stimulating them. Sometimes you might hear that phrase muscle tone. When we talk about tone, we kind of sort of know what it is, but what we mean by tone is actually a frequency. Okay? We talk about a certain pitch, like a pitch of a tone, like that. Okay? Your muscle fibers, even if not directly stimulated by the conscious nervous central, the conscious voluntary initiation of contraction, like you flex your arm, that sort of a thing, the muscle fibers will pop off on their own. Okay, that's what, and how frequently they pop off leads to increased or decreased rigidity within the muscle. So if you have good muscle tone, the fibers are slightly contracting on a relatively frequent basis. And that leads to a greater rigidity in the muscle, if you will. Your muscle tissue feels more firm and less, the word is flaccid, or flabby, okay? If you're working out and you're exercising on a regular basis, you'll have better muscle tone. This is due to internal spinal reflexes. It never really gets up to the conscious center of the brain. It's happening between the central nervous system and the muscles, but at the spinal nerve level. And what's going on is that you're just getting a little bit of pop off, a few action potentials that just kind of keep the muscle fibers just ever so slightly contracting. And that's in order to maintain readiness. They maintain readiness. So, and that results in the firmness. Okay. Healthy, I think that has to do with repetitive use more than anything than actual the tone, if you will, because tone will drop with lack of use. Okay. So I do like this idea of firmness because that's the result from the generation of tension. The readiness to respond with maximal power is also part of being in good shape. And again, muscle tension is the force of contraction. So how much tension is generated is how much force is being generated by the muscle, which again is predicated on the number of fibers that are fired simultaneously, the frequency of the stimulation, okay, along with the thickness of the fibers, et cetera, et cetera. What's cool about skeletal muscle is that you can look at a single fiber's behavior and you can look at a whole muscle behavior and the same principles apply, with the one exception of recruitment, because a single fiber is just by itself. So recruitment is the one major change there. But fundamentally, the strength at which a fiber contracts is analogous to what a whole muscle will do. So you can sort of study one fiber and apply that to a whole muscle. So you are producing tension. That's the force exerted on what we call a load. Load is either an object or it can be against another muscle in some cases. Okay. Contraction may or may not shorten the muscle. You may generate force, but the muscle doesn't shorten. When the muscle does not shorten, that's known as isometric. And it's in the word. It means same length. Metric means length. Iso means same. So an isometric contraction means that the muscle increases its tension, but it doesn't shorten. That's because the load is beyond the force that's exerted on it. So the load does not move. Okay, and this can be a very, very light object like your cell phone. You can actually practice that. Your cell phone's sitting on the table. I know it's sitting right there. It wants to talk to you, right? Don't talk to it. Just try to lift it up very, very gently, and you'll see that you can't lift the phone up without exerting some force. And that first part, when you can't lift the phone up, that's isometric. The muscle does not shorten because the load is exceeding the force that's exerted on it. So no movement, no shortening of muscle, same length. Isotonic, same tone. Remember how we said tone is the frequency at which the muscle fibers fire off? If you move something at a constant rate, like if you pick your cell phone up and you move it at a constant rate, the tone in your muscle, the muscle fiber frequency, doesn't change. And that's why it's called isotonic. Now, when you accelerate, this is why when they talk about lifting weights, they want you to lift at a constant speed. Okay, there's some reasons behind it. There's some other reasons, but the main thing is that when you accelerate, that changes the tone of the muscle. You have to use differential force in order to cause acceleration. But if we're moving something at a constant speed, what's happening is the muscle tension is exceeding the load, and you're firing off the muscle fibers at a constant rate. So same frequency is what isotonic means. The load is moved because the muscle tension has exceeded it, but it's moving at a constant speed, not an acceleration type speed. And there are two types of isotonic contraction. There's concentric, where your muscle ramps up to move the load. So you start from a relaxed state and you increase until you move the load. Okay. And then you have what's called eccentric, which is basically sort of a releasing. Okay, so let's say you're putting the phone down and you're lowering it, and the muscles are gradually getting longer as you're lowering it. That's a release, like doing a reverse on a pull-up. That's an eccentric motion, and those things can cause different types of compensatory responses in muscle in terms of development and fitness, concentric versus eccentric contractions. One thing we talk about in cell biology is that you have two general kinds of responses. You have what's called a rapid cytosolic response and a slow genetic response. And almost always both happen. When you stimulate a cell one way or another, often you'll get an initial rapid response, and over time the cell will begin adapting either to increase in readiness or change or so forth. And that's true with muscles as well. So if you begin exercising a muscle, especially under aerobic and long, more continuous, sustained exercise, submaximal, okay, submaximal. So like, for instance, running a mile or running a half mile, etc., where you're doing aerobic, where you're generating energy by aerobic means, okay? This actually, that actually a little bit of walking is often more aerobic than, say, running, for instance. But in any case, if you're doing an aerobic and endurance exercise, you're not only going to be getting the rapid cytosolic response of muscular contraction, you're getting a slow genetic response. The cell is literally making new proteins and changing its metabolism in order to be more ready for that situation. So what do? You get more efficient muscle metabolism, and you build the infrastructure so that you have better endurance, maybe better strength, because you can generate more tension, and you're more resistant to the things that would normally cause a muscle to fatigue. I think these are kind of one and the same, if you will. But in any case, how does that work? Well, one thing that's going to happen is you're going to make more capillaries. This is a process known as angiogenesis. Angio meaning blood vessel, genesis means creation. So you are improving the perfusion, which means more nutrients and more oxygen, means more resistance to fatigue. Okay, if you've got more glucose coming, you can rapidly break that down by glycolysis in anaerobic contractions. It's going to cause buildup of lactic acid, but that increase in capillaries is going to wash that lactic acid away, so you're not going to feel the burn as often. Okay. Also, more oxygen, which means that if you can run at an aerobic capacity, you're going to generate boatloads of ATP, which means less fatigue issues. Along those lines, again, more oxygen, but you certainly need more mitochondria to take that glucose and make it into ATP. So that having more mitochondria there, again, glycolysis is a cytosolic thing. It doesn't happen in mitochondria. You don't really need mitochondria in order to undergo anaerobic respiration, but you do need mitochondria for aerobic respiration, right? Because you break down glucose in the cytosol. That's glycolysis, and then you make acetyl-CoA that then goes into the mitochondria. All right, that's a different story. More mitochondria means you have more aerobic capacity, greater endurance. And then you have this molecule, I've mentioned this before, it's called myoglobin. And myoglobin stores oxygen. It's a lot like hemoglobin. It's not as efficient as hemoglobin, but myoglobin is what gives red meat its color. And interestingly, if you look at fish or reptiles, so forth, or chickens, their meat is more whitish, right? You look at fish, not every meat is white, but most fish have a white meat, and chickens with kind of a white meat, and if you ever see reptile meat, it's very white. They don't have nearly the resistance to fatigue that mammalian muscle tissue has. That's why we call it red meat. It's got tons of myoglobin, and mammalian muscles can way outlast either birds or chickens and so forth, with some exceptions. Okay, But the myoglobin stores oxygen, so you don't have to have capillary supply in order to be able to give oxygen off in times of maximal exercise. Any other organ systems that would improve? Sure. You're going to improve your heart. You're certainly going to improve your pulmonary system, and never mind the sort of indirect effects on things like mood and so forth, so forth. Now, separate from aerobic type exercise, continuous non-maximal exercise, you have what's called resistance exercise, and this gets often is much of a shorter duration, more of a burst, and is much closer to maximal effort on the part of the muscle, if not maximal effort. So this is the barbells, gym type exercise, or you can use resistance bands and so forth. Yes, it does it cause, if the contraction is a fast cytosolic response, the increase in muscle strength and size is the slow genetic response. So you get an increase in size, and that's because you're generating more fibers in the muscle fibers. We call that hypertrophy. The fibers actually get bigger. There are more thin and thick filaments and more sarcomere elements inside a skeletal muscle that's been exposed to significant amounts of resistance exercise. Certainly increase in mitochondria. That's no secret, because again, what you're wanting to do is to generate maximal power. You want as much ATP as you can bring to bear, and certainly mitochondria are good at that. Like I said, more myofibrils and myofilaments. That's part of the reason why we have the hypertrophy there. You're making the sarcomeres bigger, and more filaments means more power strokes, more power. You got more glycogen. Now, glycogen is the storage molecule for glucose. Yes, you're going to have a certain amount of glucose inside the cells, but you'll also have there glycogen that will be broken down as glucose is needed. All right. Endurance athletes, in fact, we talk about in the Boston Marathon, you get to about mile 22 or so, mile 23 maybe, and there's a slight rise. If you were just running a short distance, you'd hardly notice it, but the hill rise is about 50 some feet over a couple hundred yards. And they call it Heartbreak Hill because what's happening is the person's gotten used to running a certain speed, and so they're burning up glycogen during the race. They're mile 21, 22, and they hit this hill and they try to stay the same speed. But in order to do so, they have to go anaerobic. And anaerobic burns a huge amount of carbs really quickly. It's very fast at generating ATP, but it is very inefficient. And if you don't have any glycogen around because you've been burning it up slowly over time during this endurance race, you hit this hill and you bonk. Okay, that's the technical term, bonking, and it happens in the Tour de France too. You see when riders are riding and they'll just run out of power. That's because they just don't have enough glycogen or glucose broken down from glycogen to maintain power. Now, if you do this type of intense exercise, the issue becomes excess intensity. And this is true of people who start exercising and they want to go big and hard because maybe a year or two ago they were just totally awesome and they could do all this stuff and their brain still thinks they can do it. When you engage in high intensity exercise, whether it's aerobic or in the case of resistance, what you end up doing is you end up damaging the sarcolemma. Now, the titin and dystrophin, they do their best, okay? They are there to stretch and absorb that excess energy, but, the damage is going to happen. There's only so much they can do, and so you do end up causing small tears in the cell membranes. You literally are rupturing muscle fibers, and that's what causes this inflammation and soreness after particularly strenuous exercise or long repetitive exercise where you haven't trained. But what happens is this will stimulate the muscles to gain mass. Again, this is a slow genetic response. They will repair, they will restore as best they can, as long as you haven't actually, torn a muscle at the macro level. Okay. Overworking skeletal muscles will also damage tendons, or if it's too low, you'll actually begin getting macro tears as opposed to these micro tears. What you see when people use anabolic steroids is that because of the perfusion effect, for instance, skeletal muscles have lots and lots of blood vessels. Tendons and ligaments don't. And so what will happen is a skeletal muscle can gain mass very, very quickly because of that perfusion effect, and the tendons don't. So what you will see with folks who are abusing anabolic steroids are tendon ruptures. Okay? You will see tendon ruptures in those athletes that are using anabolic steroids because they build up muscle mass really, really quickly and they build up performance really, really quickly. But the skeletal muscle performance exceeds the load level of the tendons. Tendons generally take months. So, like for instance, people that start rock climbing again will often blow the tendons in their fingers because they can quickly gain strength in their hands, and they try to pull a really small thing, and they'll blow a tendon early on. And that's why you kind of have to work into your level of exercise so that you allow your tendons to strengthen along with your muscles. But oftentimes in professional and in competitive situations, time is your enemy, right? But that's the reason why we can get tendon damage with high level intensity exercise. Now, looking at this chart, it looks pretty complicated, and it is. We really want to do is we just want to get the basics here, okay? We have fast twitch and slow twitch, okay? You have basically one flavor of slow twitch, and it is oxidative. You have two flavors of fast twitch. This one right here, this fast oxidative, is actually now don't take me to heart with this on the test. It is still called a fast oxidative fiber, but it can do both glycolysis and aerobic. It means it can flip. It can do. It mostly does aerobic, but it can in heavy exercise flip over to anaerobic. So it's a fast oxidative. It's mostly aerobic, but it can do glycolysis and go anaerobic if needed. And then lastly, you have the true fast glycolytic fibers. This is your 40-yard dash type fiber. Maximal contraction situation. Short-term, intense, very powerful movements are involve the fast glycolytics. And you recruit these in sequence, okay? When you're doing things that are very, very easy, you'll recruit your slow oxidative. You're doing something a little more, heavy, a little more intense, you'll start going into your fast oxidative, even more intense, then you flip into the glycolytic. It's a serial recruitment, if you will, okay? Beyond that, there's just an awful lot of detail here. We don't really have to worry all about that much. Now, to be perfectly honest with you, I have no idea what this picture is about, much less the circle here. The only thing I could say is that I really feel bad for their skin. They are way over bronzed, and if they did this with ultraviolet light, they are going to be pieces of beef jerky in a few years. Smooth muscle is really, really, really cool, and I wish we had more time for it because it's actually so incredibly important. But as you can see here, it's really not going to be tested all that much. It doesn't use troponin. It uses this other one. And the really, really cool thing about smooth muscle is that there are different types of smooth muscle, and it can stay contracted for days. Literally days at a time, whereas your skeletal muscle can only be contracted for maybe up to 2 minutes. And again, not on the exam, but you still use calcium. Okay, you're still using calcium, but instead of troponin, it's calmodulin. And calmodulin, what it does is it activates a kinase. A kinase is a type of enzyme that phosphorylates a target. And so the myosin doesn't have any troponin in it, what it does is the myosin gets phosphorylated, and that turns on and creates and that initiates the power stroke. Is a phosphorylation of myosin, so it begins cycling through cocked and released hydrolyzing ATP once it's been phosphorylated. That's why smooth muscle in some cases can stay contracted for days or hours compared to skeletal muscle. Okay, now we're going to move into the muscle anatomy proper. So we've been talking about how muscles get the job done, the physiology, and now we're going to move into the anatomy side. A couple of quick things. Again, we're going to try to show you the systemic ways of understanding muscles so that if you don't always have the exact name at the front of your brain, you can use other things to help you get there. It would be lovely if we could just memorize everything so quickly and easily, and that's just not the case. So I'm going to show you some systems and try to help you gain an understanding of the larger nomenclature, if you will. So muscles all have an origin. That's usually a more fixed position. That is to say, from where the muscle originates its force, shall we say. Then there is the insertion. That's the point where the force is applied to move or do some kind of action. Not all muscles cause action. Some are stabilizers and so forth. And so this isn't a perfect system, but the muscles all have these sort of three things. They have an origin, an insertion, and an action. Muscles, especially muscles involved in motion, have, you talk about the agonist muscle. That's like, for instance, your bicep is the agonist in arm flexion. And then you have an antagonist. Now, we use this same terminology when we talk about different kinds of drugs. Okay? For instance, if you had a drug that could mimic insulin, it would be an insulin, or cause insulin release, it would be an insulin agonist. Okay? And if it was something that would inhibit insulin, it would be an insulin antagonist. But in any case, we have oppositional muscle groups. We have agonists and antagonists. So the triceps are for arm extension, and the antagonist of the triceps would be the biceps. Okay? You have multiple muscles that are doing sort of the same thing. That's what we call synergy. So, for instance, the quadriceps muscles are synergizing. They're working together in slightly different directions in order to achieve the same thing, which is leg extension. And you have fixator muscles. These ones stabilize the origin. They help maintain posture, et cetera, and help create a relatively immovable object so that force can be applied somewhere else. And so again, the agonist would be, like you say, the prime mover of a given type of motion in the body. Now, here's one of the reasons why we focused on regions a little bit early on in the class, is because many things in the body that, when it comes to especially muscles and bones and other things, are named by virtue of where they're located. So getting to know those regions is a very, very useful thing. Because we name muscles either by the region that they're located in, okay, or the bone that they're attached to. I always think of pecto and a brachialis because it's telling you the three things that it's attached to, okay. Sometimes, often, muscles are named by their action, like this one here. This is a flexor. It's part of the carpal, so it means it's a wrist, and the radialis. So it's down. It's causing some type of motion in the wrist, okay? Number of attachments like biceps, triceps, quadriceps, and then region, brachii, all right? That's the biceps brachii is the big bulging muscle on your upper arm. The shape, for instance, the trapezius, there are some unusually shaped ones, rhomboids and so forth. Size, okay, maximus, gluteus minimus, some things are long and so forth. And whether they have a direction. Sometimes
We talk about obliques. That's because they are at an oblique angle, which means at a diagonal to the long axis. And so let's use the face as an example of some of these naming conventions. All right. For instance, the frontalis. All right. These are the muscles that are often associated with headaches. Okay. It's on the frontal bone of the skull. Okay. The zygomaticus. Okay. That's on the zygomatic arch of the skull. All right. Again, what bone it's attached to. And orbicularis oris. All right. Again, going around the mouth. Again, the location. Okay. Sternocleidomastoid. Okay. It hooks to the sternum. It hooks to the mastoid process, and it hooks to the collarbone. Okay. Trapezius by shape. Masseter is a chewing. That's by action. The buccinator is also the kissing one. It causes the mouth to kind of form an oval, a rounder shape. Temporalis, again, location, and so forth. So where we see purple underlines are examples of using that naming convention, or even levator here, examples of these things. Naming conventions for these different muscles. And these ones that are in purple are the ones that you should probably be able to at least call on or recognize. In this slide, we just have a nice picture of a couple of the major muscles of mastication, otherwise known as MOMS. We certainly have the masseter here, and that's the big powerful muscle for closing the jaw. And we also have the temporalis muscle, again, hooking up to the temporal, covering the temporalis bone there on the cranium. Okay, MOMS, muscles of mastication. These muscles shown right here are important for positioning the head, whether it's in posture or in motion, and it's a complex motion. So you have multiple muscles that function. You have two of these splenius muscles. Okay, one is the splenius capitis, hooking up to the skull. One is the splenius cervicus, which is associated with the cervical spine. You also have the semispinalis capitis. Again, look at the naming convention here. Splenius means patch. And, again, that's sort of alluding to the shape of the muscle here. Along those lines, we have muscles further down the back. We've talked about the semispinalis before. That's up in here. Then we have the true spinalis, and this one's only showing the thoracic form of it. And again, the idea here is location, what bones it's attached to. Longissimus, and you can allude from that it's a very long, extended muscle, very important for extension of the back. And then we have one here that's named after the bones that it's attached to, the iliocostalis. So it's hooked up to the iliac crest of the pelvis and to the individual ribs. You can see the insertions there along the ribs there. That's why it's called the iliocostalis. On the ventral side, we have the abdominals, of which the one that's usually the most visual in folks that are in very, very good shape would be the rectus abdominis. And the rectus abdominis is unusual in that it has these tendinous insertions at various points. Not unlike the iliocostalis that hooks into the ribs and so forth, you do have these tendinous insertions. Splitting the rectus abdominis, you have what's called the linea alba, which means white line. The other ones are just in deeper layers, and they are in different directions, okay? So you have an internal and external oblique muscles, the external being on the outside and the internal being on the inside. And you can see that they're roughly perpendicular to each other, but at a 45 or so relative to the rectus abdominis. And then you have a deeper inner layer still called the transverse. And again, transverse means at an angle. Okay, this one is almost perpendicular to the rectus abdominis. So you have the rectus abdominis, you have the external, internal, and transverse muscles. When it comes to the rib muscles, you have three layers here. You have an external, an internal, and an innermost. Don't you love that? Why don't they just call that the medial? I don't know why. Don't ask me. Okay. And these are meant to help articulate and change the shape of the thoracic cavity. They provide force when needed in like cases of forced expiration. None of these are really involved in inspiration so much. Inspiration often involves a lifting, if you will. Doesn't mean they're not involved, but these guys are usually a little more involved in exhalation than inhalation. Now, a relatively unusual skeletal muscle. Relatively unusual in that it is mostly involuntary. It will function just fine on an involuntary level. That's why we don't say voluntary and involuntary all that much. At least I don't. That's because this is skeletal muscle, but it functions involuntarily for most of your standard, what we call tidal volume breathing. Tidal volume is about half a liter. Half a liter in, half a liter out. That's your normal resting breathing. And it is skeletal muscle. It is known as the diaphragm. And what happens is it contracts. And when it contracts, it increases the volume of the thoracic cavity when it contracts. And when it relaxes, it moves upward, decreasing the volume of the thoracic cavity. So when we talk about diaphragmatic breathing, what you're talking about is inhalation is contraction and relaxation is exhalation. Relatively unusual in the skeletal muscle world. So muscles of the arm, upper, or what we call the superior limb, if you will. You have one that's named by virtue of its shape. It's the trapezius. Okay, it has this sort of triangular shape going on. You've got the lat dorsi. That's when you talk about doing your lats when you're doing either a pull-up or using the lat machine, latissimus dorsi. It's extending the arm, okay? We have, let's see, levitators. Again, this one's more involved in lifting, like you're shrugging. Okay, that's why we call it a levator, and it's raising the scapula, okay? Then you have some, if you know what a rhombus is, I'm not going to tell you exactly what a rhombus is, but look at the shape. I want you to look here, okay? A rhombus, well, I'll give it away. All right, I give it away. It's like a square, but instead of being 90-degree angles, you have other angles. And it's a form of parallelogram, if you will. And so you got the major and minor here. You've got an abductor, okay, that's your deltoid, that's the big bulky muscle on the top of your shoulder, okay? Not too bad, I hope. And so here's another picture of the deeper muscles of the upper extremity. You have your rhomboids, again, named after the shape that they're involved in. And again, that sort of parallelogram shape. And then you have the levator scapula. Again, the sort of shrugging your shoulders. It's not the only muscle involved in that, but it is one of them. Some muscles of the rotator cuff. These are ones that frequently get damaged, with excessive or violent motions of the shoulder. This is looking back to front, so you're looking at the patient's right hand shoulder right now. Again, by position, subscapularis, it is underneath the scapula. You have the supraspinatus, abduction. You have the infraspinatus, it's involved in rotation. Teres minor, and here's the scapula, here's the humerus, and so forth. On the ventral side of the body, you have the pectoralis muscles. You have the primary one, the pectoralis major, and then deeper into underneath the pectoralis major, you have the pectoralis minor muscles. When it comes to the muscles inside the upper extremity, the general convention is that anything that moves the hand and wrist towards the head, towards the anterior, those are flexors. Anything that moves them away from the head would be considered extensors. And so you have the big biceps brachii. That's the prominent muscle that is seen on the upper, above the elbow. Underneath that, you do have a brachialis muscle. And then down underneath the elbow, you have, again, this is telling you the bones that it's attached, sort of attached to, the brachioradialis. It's hooked to the humerus and hooked to the radius. All right. On the dorsal side, you have the triceps. You have a medial, a lateral. You have a long one, and there's another medius in here as well. Again, it's hard. It's kind of running through and underneath. And you also have a prominent tendon here as well. And so in the inferior limb, we have the quads, okay, the rectus femoris, the vastus medialis, okay, so the large and in the middle, the large in between, and the large lateral, okay. Now, deep to the rectus femoris, you have this, that's the vastus intermedius. It's kind of hard to see in there. TFL is for tensor fasciculata. Okay, it's a large flat muscle on the outside, and in the middle here we have the gracilis. That's part of the groin. Okay, and then lastly, there's a nice question here for you. Which of these is the longest muscle in the body? And I have a little joke to say for you. It is the notorious sartorius. That's the way to remember the longest muscle in the body. Okay. So again, you just have 4 quads here, and outside, inside, and then the sartorius, which kind of runs like a long ribbon down through here. Couple of gluteal muscles to deal with. Certainly the gluteus maximus. Most people know about that. It hooks up to the iliac crest and is also attached to what is known as the IT band or iliotibial band. This one is very, very common in distance runners, that people have iliotibial band issues. It's a very, very long tendinous structure that runs all the way down to the tibia. So it runs from the iliac area to the tibial region. That's why it's called the iliotibial band. Now, underneath the gluteus maximus, you have the gluteus medius. It's a little medial and therefore underneath the maximus. Here's the tensor fasciculata. That again hooks into the iliotibial band and helps stabilize the pelvis and the lower extremities during standing or walking and running. Hamstring muscles, okay, again, they're mostly named after their sort of shape or that sort of thing. The semimembranosus, okay, again, that's the most medial. The semitendinosus, which is in the middle and has a more pronounced tendon. And then the biceps femoris, again, very much like your biceps brachii, but on the back of your leg. 2 insertions, that's why it's called biceps. So we have 3 muscles primarily situated on the front of the leg to look at. The one that is often most prevalent in the lower leg is the most superficial one, the tibialis anterior, and that's involved in flexion. Okay, it brings the toes up towards the chin, if you will. Now, you also happen to have an extensor in here. The extensor digitorum longus actually projects down into the ankle and is involved in extension, the opposite of the tibialis. All right. And you also have a second extensor here, the extensor hallucis longus, which again is buried a little bit deeper down in there. And again, it's doing exactly what it says. It's an extensor. Muscles on the dorsal side of the leg, the most prominent being the gastrocnemius, a large, very bulky muscle in many cases, very well pronounced, especially with people who don't have a lot of subcutaneous fat on their lower legs. There's also a lower, more sheet-like muscle called the soleus. It's shown here. And then you also have this plantaris muscle, which is the one that kind of creates the little puffiness on the back of the knee. If you look at the back of someone's knee and they kind of have that kind of middle portion, that's actually primarily due to the muscle that's sitting there, running underneath the Achilles tendon, if you will. And so this concludes the part 2 of the muscle tissue and muscle systems, focusing on anatomy. Now, again, Work on the easy stuff first. Get the easy stuff locked down and then come back with subsequent layers and try to pick up maybe one per slide or that sort of a thing. The key is to have patience with yourself, keep working on it, find ways to remind yourself rather than just trying to remember every little thing absent of context. That just doesn't work. The key is layers, layers, layers. Repeat, repeat, repeat. Get the easy stuff first, knock off one little tougher thing. If you don't get it the next time, just keep focusing on that tougher thing until you get it and then move on. Okay, good luck. I will see you soon, and I wish you all the best. Thank you.